presidential race. You said you were a progressive. You've been a progressive in the Senate. Progressive
proven
Democrat.
progressive.
Well,
No, I think it's important. I think you want to
But you also said you're a pragmatist.
Yeah.
Is your party moving too far to the left right now in this presidential race?
We have a lot of voices in our party. We are not the party where one man, as in the Republican side, Donald Trump, says, how high can you jump? And everyone says, oh, maybe I'll jump as high as I can. They just go as whatever he wants right now, they're doing. We are a party that has different views. That's what happens when you include more people in America, and we've always been that way. So I am buoyed by what happened in 2018, where people came together in our party and were joined by independents and moderate Republicans. Don't forget that coalition, where you think, how did we win the governorship of Kansas with a woman candidate, Laura Kelly?
But they weren't all running on Medicare-for-all.
I know, I'm going to get to that in a minute. I'm just leading with the positive. I'm kind of a happy warrior. And looking at the proof here is that we came together. We elected more women than ever before. We elected more people of color than ever before. And we won in states that no one thought we could. And if you don't believe me, 4 words: former Governor Scott Walker, all right? So, okay. I can only speak to my views on these things. So my views on these have been very clear from the beginning. I have not vacillated. I am someone that believes we need to improve on our health care. We need to reduce costs for our health care. And there are many ways we need to do it. And the first is that we should build on the Affordable Care Act. By the way, we could immediately do something with cost sharing and reinsurance, which doesn't exactly fit on a cool bumper sticker, but it is something that there is a bipartisan bill, and it's been proven to work in many states. But the big ticket item is to have a public option. And you can do it with Medicaid, you can do it with Medicare. And no, I don't believe we should kick half of America off their private insurance in 4 years, which is exactly, very clearly what that bill says, the Medicare-for-all bill. At the same time, I don't think that it is an incremental step to go to a public option. I think that is a bold step. It's something that President Obama wanted to do, and it is a way that we could bring costs down for everyone by having an option for them to buy into. The other big ticket item that no one has dealt with under Democratic or Republican administrations is taking on pharmaceutical prices. And I have led on that since I've gone to the Senate. The vote on bringing less expensive drugs from Canada, that was a Klobuchar-Sanders amendment. The bill to allow for unleashing the bargaining power of 43 million seniors so they can get less expensive prices under Medicare, that's a bill that I've led for years. And pharma thinks they own Washington. They have 2 lobbyists for every member of Congress. They don't own me. And I think this is way past time to work on. So I'm actually really excited about this. A president herself can actually apply for a waiver to lift the ban on bringing in less expensive drugs from other countries. Imagine the competitive impact. You can stop pay-for delays, a bill that Grassley and I have had for years, that would stop Big Pharma from paying off generics to keep their products off the market. They know there's change ahead, but it's going to become much firmer and stronger if I lead the ticket. And
Vice President Biden